Welcome to Droppin' Knowledge with Dr. G. We got a question. Someone writes in, what is the best way to treat nerve pain? Well, number one, before you diagnose it as nerve pain, make sure it is nerve pain. A lot of people will say call things nerve pain because it burns or it shoots or it tingles. We know from multiple studies that joints and ligaments and even sometimes the venous or arterial system, blood vessels, can refer pain the same way a nerve does. Just because something burns and tingles doesn't mean it's a nerve. A lot of times people with vascular disease will have numbness and tingling as well because the blood vessels that feed the nerves are dying off, but it's a blood vessel problem, not a nerve problem. Also, muscle tears and ligament tears release inflammatory chemicals that act like acid that contract between some of the tissues and trigger some of the nerves in the fascia, like the sympathetic nervous system, and that can lead to referred pain. Sometimes arm pain is a rotator cuff tear. Sometimes it's a nerve injury. Sometimes it's a heart attack. So just because it feels like nerve pain doesn't mean it's a nerve. Make sure you get nerve conduction studies and a thorough neurologic exam. Once you've diagnosed and confirmed you have nerve pain, the question is how do you treat it? There's different ways. Typically medications, anti-inflammatories, and certain types of nerve or anti-seizure medicines can be effective. That's a whole long host of meds that we can go through at some point in time. Opioids do not typically work well long-term for nerve pain. Methadone kind of does, but the truth is most opioids run the risk of worsening nerve pain by something called opioid-induced hyperalgesia, which is a fancy term meaning narcotics will worsen your nerve pain. So for chronic nerve pain, I try to get the patients off the narcotics. Actually, for all scenarios, we really try to do that, but especially nerve syndromes. Number two is to do nerve blocks. We can do injections of the nerve. A nerve block just means taking a needle under ultrasound or x-ray, finding the nerve and injecting medicine on it to either calm it down with an anesthetic, to break the firing cycle and give it a couple hours of relief in hope that we can kind of reboot or control-alt-delete that nerve, or putting steroids on it to decrease inflammation. Since for chronic nerve pain, we do know there's something called neurogenic edema and neurogenic inflammation. The nerve becomes inflamed, and as a result, it releases chemicals that inflame itself. That's kind of like starting a fire that then produces kerosene and pours kerosene on itself, and it starts to cycle. And our nerve blocks are done to block that inflammation and that crazy nerve firing for a while. The other option is to block centrally. We can do spinal cord blocks, we can block the sympathetic nervous system, or we can block it peripherally. So if you have pain in your thumb, I can do an injection of the nerves of the thumb, or the median nerve before it feeds the thumb, or I can do it in the brachial plexus up here, or I can block that nerve, which would be C6 nerve root by the spine, or in the spine is a spinal epidural. Or I could block the sympathetic nervous system, which is outside the spine. It depends on your presentation and your examination. So make sure when you're getting evaluated for this, you have a thorough examination before anybody ever tries to touch you with a needle or put a pill in your mouth. Hair's looking good.
Which one?
So good. All of my hairs. Both eyebrows.
Both hairs.